Hey everyone, and welcome. Today we are cracking open the doctor's toolkit to get a handle on one of the biggest medical challenges out there, high blood pressure. We're going to break down how all these different medications work, and we'll do it using a really simple analogy that I promise is going to make it all click. So let's dive right in.
So here's our game plan. First up, we'll get a grip on the problem itself. Then we'll start exploring the main tools in the kit, breaking them down by what they do, easing the heart's pump, relaxing the body's pipes, or just reducing the amount of fluid in the system. After that, we'll look at a sort of master switch that controls everything, and finally, we'll see how doctors figure out which tool is the right one for the job.
Okay, so let's just start with the scale of this thing. Why is high blood pressure such a big deal? Well, you've probably heard it called the silent killer, and that's not an exaggeration. It often has no early symptoms, which is exactly why it's become this huge, global issue that affects people absolutely everywhere.
And when I say huge, I mean the scale is just staggering. We're talking about nearly 1 billion people around the world living with hypertension. Think about that for a second. That's more than 1 out of every 8 people on the entire planet. And it's a leading cause of really serious stuff like heart attacks and strokes.
So what is it exactly? It's pretty simple, really. Your blood pressure reading always has 2 numbers. That top number, the systolic, that's the pressure when your heart is in the middle of a beat, when it's pumping. The bottom number, diastolic, is the pressure when your heart is resting between beats. Hypertension is just when one or both of those numbers are consistently too high.
Now here's where it gets interesting. Where does it come from? For the vast majority of people, something like 95%, there's no single clear cause. We call this primary or essential hypertension. Only in a tiny fraction of cases is it a side effect of something else, like a kidney issue.
To really get how these drugs work, we need to understand the basic science. And honestly, it all boils down to this one little equation. Blood pressure equals cardiac output times total peripheral resistance. But don't worry, don't let this scare you off. I promise there's not going to be a math quiz.
In fact, we're going to translate that science into a super simple analogy that we'll use for the rest of this explainer. Just think of it like this. The pressure in the whole system equals the heart's pumping power multiplied by how much the body's pipes, the blood vessels, are squeezed. Every single medication we talk about is designed to mess with one of these 2 things.
All right, let's open up that toolkit and pull out our very first tool. These are the drugs designed to tackle the pumping power part of our equation by going right after the heart itself.
The strategy here is pretty straightforward. Just tell the heart to chill out a bit. These drugs basically act like a governor on an engine. They reduce its speed, the heart rate, and they reduce the force of each beat. The big players here are beta blockers and a few types of calcium channel blockers. It's simple. Less pumping power equals less pressure.
Okay, on to our second set of tools. If you can't change the pump, you can always change the pipes. These medications ignore the heart and focus on that pipe squeeze part of our analogy, targeting the blood vessels directly.
And this is a perfect example of how clever these tools can be. See, we just mentioned calcium channel blockers, or CCBs, but it turns out there are different kinds. Some, like we just saw, focus on calming the heart, while others primarily work to relax and widen the blood vessels, our pipes.
So the whole strategy here is just give the blood more room to move. By making the blood vessels wider, these drugs lower the resistance. It's kind of like switching from a narrow, high-pressure garden hose to a big, wide fire hose. The same amount of water is flowing, but the pressure pushing against the walls drops way down. All right, time for our third tool. So instead of going after the pump or the pipes, this one focuses on what's actually inside them, the amount of fluid in the system. These are called diuretics, but you've probably heard them called water pills. And their job is simple. They tell the kidneys to get rid of more salt. And since water always follows salt, the body flushes out more water too. This directly lowers the total volume of blood you have circulating around. And the logic here is just common sense, right? If you have a closed plumbing system and you take some of the water out, the pressure just naturally goes down. It's a really effective and one of the most common strategies out there.
Okay, now we're getting to a much more sophisticated target. Your body actually has its own complex system for managing blood pressure, and it's all run by hormones. You can think of it like a master control switch, and this next set of tools lets doctors flip that switch themselves.
Let me walk you through this. So the body makes this stuff called angiotensin 1. Then an enzyme called ACE comes along and converts it into its super active form, angiotensin 2. And this stuff, wow, it is powerful. It does 2 main things. It squeezes the pipe tighter, and it tells the kidneys to hang on to more fluid. And as we know, both of those things send blood pressure soaring.
So once you understand that process, the drugs make perfect sense. ACE inhibitors jump in at step 2. They block that enzyme so the powerful hormone never even gets made. Problem solved. ARBs work a little later, at step 3. They let the hormone get made, but they physically block it from delivering its message. It's like 2 different ways of cutting the same wire to get the exact same result. Pretty clever.
Okay, so we have all these incredible tools in the toolkit, but how on earth does a doctor decide which one, or maybe which combination, is right for a specific person? Well, this is where science really meets the art of medicine.
A lot of the time, the choice of tool depends on what else is going on with the patient. For example, those ACE inhibitors and ARBs, they also help protect the kidneys, which makes them a fantastic choice for someone who also has diabetes. Another tool, alpha blockers, can help with symptoms of an enlarged prostate. The real art is finding a tool that can do 2 or 3 jobs at the same time.
And of course, we can't forget that the toolkit isn't just about pills. These lifestyle changes are the absolute foundation of blood pressure management. For a lot of people, just doing these things is enough to get everything back in check. And even for those who need medication, these habits make every single tool in the kit work that much better.
So, what's the big takeaway from all this? Well, it's that treating high blood pressure is not a one-size-fits-all kind of problem. It's a really personal process of picking and choosing from this amazing toolkit, easing the pump, relaxing the pipes, reducing the fluid, or flipping that master switch to find the perfect fit for each person's body.
And that leaves us with a really fascinating question for the future. We've seen how treatment is personalized based on other health conditions. But what if it could be personalized based on our actual DNA? Just imagine a future where a simple test could tell a doctor exactly which tool from the kit will be the perfect one for you, taking all the guesswork out of it. It's definitely something to think about. Thanks so much for watching.